Let's start with a truth that surprises many people. More than half of men over the age of 40 will experience some form of erectile difficulty at some point in their lives. And yet, when I meet patients in clinic, most of them tell me they feel embarrassed, broken, or even ashamed for struggling in this area. Women, too, often carry a quiet burden when their partner's erection changes, questioning their own desirability or silently worrying that something deeper is wrong. But here's the good news: your body is not broken. Erections, like any other physiological process, are complex, influenced by blood flow, hormones, nerves, mental focus, and emotional safety. And the truth is, there are small, science-backed techniques that can make a significant difference. Today, we're going to explore one specific trick, something you can do before sex that dramatically improves the quality and consistency of your erection. This isn't about gimmicks. It's not about overpromising or selling you something flashy. It's about understanding the way your body actually works and then applying that knowledge in a very practical way. Think of it like preparing your muscles before a workout. The right warm-up can change the whole outcome. Your sexual system isn't any different. Now, why does this matter so much? Because sexual health is more than just performance. For men, reliable erections are linked to vascular health, confidence, and relationship satisfaction. For women, when their partner feels confident and connected, intimacy often becomes more relaxed and fulfilling. And beyond relationships, consistent sexual function is actually considered a vital sign of overall health, the same way we track blood pressure, cholesterol, or sleep quality. Unfortunately, many people are misled. You've probably heard myths like, if you can't get hard, it's just in your head or it's inevitable with age. Nothing can be done. But science tells us otherwise. Erectile function is multifactorial, and with the right strategies, often very simple ones, most men can improve dramatically. So in this consultation-style session, we'll break down 6 key insights that can change the way you think about erections and intimacy. We'll discuss what this one trick really is, why it works, and how to integrate it into your life. Along the way, I'll bust some myths, explain what's normal versus what's not, and give you the tools to take back control. And here's the most important thing I want you to hear at the start. You're not alone, and you don't have to carry shame. This is common, it's human, and it's absolutely worth talking about openly. By the end of our time together, my hope is that you'll feel more informed, more empowered, and more connected, both to your own body and to your partner. When a man first notices that his erections are weaker, take longer to achieve, or don't last as long as they used to, the first instinct is often to blame himself, to think I must be too stressed or I'm just getting older. But let's break this down without judgment, just truth. An erection is a vascular event. That means it's primarily about blood flow. Inside the penis are 2 sponge-like chambers called the corpora cavernosa, and when you're aroused, tiny arteries open, filling these chambers with blood. At the same time, small muscles around the base of the penis compress the veins, trapping that blood inside so the erection stays firm. If any part of the system falters, the arteries don't deliver enough blood, the nerves don't send strong signals, or the veins let blood escape too quickly, the result is a softer, shorter lasting erection. Think of it like inflating a balloon with a very small leak. No matter how much air you blow in, it never stays fully firm. This is why erectile issues are often an early warning sign of vascular disease, sometimes even before high blood pressure or heart symptoms show up. According to studies published by the Mayo Clinic and Harvard researchers, men with erectile dysfunction have a significantly higher risk of future cardiovascular events like heart attack and stroke. Your penis, in other words, is telling you something important about your overall health. But it's not just blood flow, hormones play a role too. Testosterone isn't just about libido, it supports the sensitivity of penile tissue and the responsiveness of the brain's sexual centers. Low levels can make it harder to get and maintain an erection. And then there are the nerves, which must fire rapidly and consistently to keep the process going. This is why conditions like diabetes, multiple sclerosis, or even chronic lower back pain can interfere with erections. They damage or disrupt the nerve pathways involved. And finally, there's your mental and emotional state. If you're under chronic stress, your body produces more cortisol and adrenaline, stress hormones that can constrict blood vessels and blunt arousal. Anxiety, especially performance anxiety, can create a vicious cycle. One bad experience leads to worry, which leads to more difficulty next time. So, what's the takeaway here? First, if you've noticed a change in your erections, don't ignore it and don't blame yourself. It's not a sign of weakness, it's a sign to get curious. Consider this a vital sign, just like checking your blood pressure. Talk to your doctor about screening for cardiovascular risk factors, cholesterol, blood sugar, blood pressure. And if you haven't had your testosterone checked, ask about it. And second, be compassionate with yourself. This is common, and it doesn't have to mean the end of satisfying intimacy. By understanding what's happening, you can take steps to address it early, which often leads to better outcomes for your health and your confidence. One of the most common things I hear in clinic is this, "Doc, I think this is just mental. Maybe I'm too stressed. Maybe I just need to relax." And yes, the mind absolutely plays a role in sexual function. But let's be clear, erectile issues are almost never only in your head. Here's what the science shows. Large studies from the Cleveland Clinic and the American Urological Association consistently find that the majority of erectile dysfunction cases, particularly in men over 40, have at least some physical basis. That could be reduced blood flow, subtle nerve changes, or even side effects of common medications like blood pressure pills, antidepressants, or prostate drugs. Psychological factors can certainly amplify the problem. Anxiety is like static on a radio. It can interfere with the signal between your brain and your body, making it harder for the erection reflex to fully kick in. But the underlying circuitry, blood vessels, nerves, pelvic muscles, still needs to be functioning well for a firm erection to happen at all. So if you've been blaming yourself, telling yourself, "I just need to calm down," I want you to hear this. It's not about willpower. You can't simply think yourself into a reliable erection. Just like you wouldn't blame yourself if your ankle was swollen, you don't need to carry shame if your erections aren't what they used to be. This is physiology, not failure. Here's a simple way to tell if there's a physical component. Ask yourself whether you still get nighttime or early morning erections. These are controlled by the spinal cord and happen automatically during REM sleep regardless of your thoughts. If those have diminished or disappeared, it's a strong clue there's a physical cause that deserves attention. And remember, addressing the physical doesn't mean ignoring the psychological. Stress, relationship tension, and self-criticism can all make things worse. This is why I often encourage couples to talk openly without blame about what's happening. The more pressure you put on yourself, "I have to perform or else," the more adrenaline you produce, and adrenaline is the enemy of erection because it constricts blood flow. So what can you do right now? If this resonates, drop a comment. You're not alone, and others will feel encouraged by your honesty. And consider having a candid conversation with your healthcare provider. Be specific. Tell them how often this happens, whether you still wake up with erections, and what medications you're on. This helps them distinguish between psychological and physical contributors and create a plan tailored to you. The bottom line, this is not just in your head. Your body is giving you signals, and with the right approach, most men see real improvement. This is the part most of you have been waiting for, the practical science-backed trick you can use before intimacy to reliably boost erection quality. And it's not a pill, a supplement, or anything gimmicky. It's something you do with your own body that takes just a few minutes. Here's the secret. Preload your erection by stimulating blood flow before sex, deliberately and intentionally. Think of it as a warm-up for your sexual system. Athletes don't start a sprint without stretching and activating their muscles first because they know their performance will suffer. Your penis works the same way. It responds better when blood vessels are already open, oxygen levels are higher, and your pelvic floor is engaged. Physiologically, here's what happens when you begin light arousal, whether through manual stimulation, mental imagery, or a few minutes of partnered foreplay. Nitric oxide is released in the penile tissue. This chemical messenger relaxes the smooth muscles in the arteries, allowing more blood to flow in. Once those chambers are partially filled, the veins at the base start to narrow, which helps trap the blood. If you then pause and take a few deep, slow breaths, activating your parasympathetic rest and digest nervous system, you allow that blood to fully saturate the tissue before moving to full penetration or vigorous activity. This simple sequence does two things: increases rigidity and staying power because the erectile tissue is maximally oxygenated, reduces performance anxiety because you have already confirmed to yourself that you can achieve a solid erection before the main event. You can also add a quick pelvic floor contraction routine to amplify the effect. Here's how: tighten the muscles you'd use to stop the flow of urine midstream, hold for 5 seconds, then relax for 5 seconds, repeat 5 times. This pumps extra blood into the penis and strengthens the base of the erection, giving it that lifted feeling. And if you want to take it one step further, combine this with gentle breathing. Inhale through your nose for 4 seconds, hold for 2, and exhale for 6. This drops your heart rate, calms adrenaline, and lets arousal build naturally. The result? Instead of rushing into sex and hoping your body catches up, you've primed it both physically and mentally for optimal performance. Try this the next time you're intimate and notice how your body responds. Many of my patients report not just stronger erections, but a more connected experience with their partner because they're slowing down and being more present. If you're finding this helpful, subscribe so you don't miss future evidence-based tips like this. And remember, you deserve to feel confident and in control of your sexual health. Most men don't think about their pelvic floor until something goes wrong: leakage after prostate surgery, pain, or changes in erection quality. But this hidden network of muscles is absolutely essential for sexual function. Think of it as the hammock or trampoline at the bottom of your pelvis. It supports your bladder, rectum, and reproductive organs, and it provides the squeeze that traps blood inside the penis during an erection. When your pelvic floor is working well, it's like having a perfectly tuned set of guitar strings, responsive, strong, and balanced. But if it's too weak, blood can escape too quickly, leading to partial or short-lived erections. And if it's too tight, which happens more often than you might think, especially in men who sit for long hours, lift heavy weights without proper stretching, or carry stress in their hips, it can actually block blood flow and create pelvic pain, premature ejaculation, or difficulty getting fully hard. So how do you know where you stand? Here's a quick self-check. Next time you urinate, see if you can stop the stream mid-flow. If you can't, or it feels very difficult, your pelvic floor might be weak. If you notice pain, burning, or tension in your perineum, the area between the scrotum and anus or hips after intimacy, that may be a sign of overactivity or tightness. The good news is that you can retrain these muscles. For weakness, classic Kegel exercises work well, but they must be done correctly. The goal is to contract the muscles you'd use to stop urine flow, hold for 5 seconds, then release fully. Start with 5-10 reps, once or twice a day. Over time, you can build up to longer holds or quick flicks to train responsiveness. For tightness, focus on relaxation. Deep breathing, hip stretches, and positions like child's pose or happy baby can lengthen the pelvic floor and release tension. Some men even benefit from pelvic floor physical therapy. Yes, this is a real specialty where a trained therapist teaches you to coordinate your muscles and reduce chronic tension. By improving the function of your pelvic floor, you're not just boosting erection strength, you're also improving orgasm intensity and bladder control, which can significantly enhance confidence in the bedroom and beyond. If you've struggled with pelvic pain or weak erections and no one has ever mentioned the pelvic floor to you, this is your invitation to get curious. Leave a comment if you want me to make a dedicated video about male pelvic floor health. I'd love to break down exercises and stretches in more detail. When we talk about sexual health, many people expect a prescription or a supplement. But the truth is, some of the most powerful ways to improve erections are found in your daily habits. Your penis is an early detector of how well your entire vascular system is functioning. So, what supports heart health generally supports sexual health too. Let's start with sleep. Studies from Harvard and the Mayo Clinic show that men who consistently sleep less than 6 hours a night have lower testosterone levels, higher stress hormones, and more erectile issues. Testosterone is released in pulses during deep sleep, particularly REM sleep. So if your sleep is fragmented, your hormones take a hit. Aim for 7-8 hours of quality rest. And if you struggle with snoring or apnea, get it checked. Untreated sleep apnea is a major but often missed cause of erectile dysfunction. Next, exercise. Moderate aerobic exercise, like brisk walking, cycling, or swimming, increases nitric oxide production, lowers blood pressure, and improves circulation. Think of it as cleaning the pipes so blood can flow freely. Strength training also plays a role by increasing growth hormone and supporting a healthy body composition, which helps maintain testosterone levels. You don't need to spend hours in the gym. Just 30 minutes, 4 or 5 times per week can make a measurable difference. Nutrition matters too. Diets rich in whole foods, vegetables, fruits, whole grains, healthy fats like olive oil, and lean protein are associated with better erectile function. This is partly because these foods reduce inflammation and keep arteries flexible. Excess sugar, processed foods, and trans fats, on the other hand, contribute to plaque buildup, which narrows blood vessels and impairs blood flow. Then there's alcohol and smoking. Moderate alcohol, about 1 drink per day, is generally okay, but heavy drinking blunts testosterone and damages nerves. Smoking, even vaping, directly damages blood vessels and accelerates erectile decline. Quitting is one of the fastest ways to improve function. And finally, stress management. Chronic stress keeps your body in fight or flight mode, pumping out adrenaline that constricts blood vessels. Meditation, mindfulness, or even a few minutes of deep breathing before intimacy can shift you into rest and digest mode, the state where arousal thrives. The beauty of lifestyle changes is that they're cumulative. You don't have to be perfect overnight. Pick one small thing, go to bed 30 minutes earlier, take a 20-minute walk after dinner, or swap soda for water. Over weeks and months, these small shifts add up to stronger erections, better energy, and even improved mood. And here's the key. These changes aren't just about sexual health. They protect your heart, brain, and overall longevity. Your penis is simply the most immediate feedback system letting you know you're on the right track. Sometimes, even when you're doing everything right, getting good sleep, exercising, eating well, your erections still aren't where you want them to be, and that's okay. This is when it's time to bring in professional help. Think of this like going to the mechanic for your car. You wouldn't ignore the check engine light, you'd get it looked at before something more serious develops. The same applies here. Erection changes are a signal, not a verdict. So when should you see a doctor? If you notice that your erections have become consistently weaker for more than 3 months, if you're no longer waking up with morning erections, or if you have other symptoms like fatigue, low libido, or changes in urination, it's worth getting evaluated. Here are the tests I typically recommend in clinic. Basic labs, fasting blood sugar or HbA1c to check for diabetes, a lipid panel to check cholesterol, thyroid function tests, and total testosterone drawn in the morning. Blood pressure check. High blood pressure is one of the leading silent causes of erectile dysfunction. Medication review. Many common prescriptions, blood pressure pills, SSRIs, and prostate medications can affect erections. Sometimes switching medications or adjusting dosage helps dramatically. If your doctor suspects a more specific cause, they might order a penile Doppler ultrasound to look at blood flow or recommend a referral to a urologist who specializes in sexual medicine. Now, what about treatment options? The good news is there are many evidence-based choices beyond lifestyle. The most well-known are PDE5 inhibitors, medications like sildenafil, Viagra, and tadalafil, Cialis, which increase nitric oxide signaling and help blood flow into the penis. When used correctly, these are safe for most men and have a very high success rate. But that's not all. For men who don't respond to pills, there are vacuum erection devices, pumps, injectable medications that directly relax penile blood vessels, and even low-intensity shockwave therapy, which some studies show can improve blood vessel health over time. And for men with confirmed low testosterone, hormone replacement, carefully monitored, can restore libido, energy, and erectile function. The key is individualized care, not a one-size-fits-all approach. The most important thing I want you to take away is this: needing medical support doesn't mean you failed. It means you care enough about your health and your relationship to take action. There are more solutions than ever before, and a skilled clinician can guide you toward what's safest and most effective for your specific situation. If there's one thing I want you to walk away with today, it's this: your erection is not just about sex. It's a barometer of your overall health, your emotional well-being, and your connection to your partner. What we've talked about today isn't about chasing perfection. It's about understanding your body so you can work with it, not against it. Let's quickly recap what we covered. First, we learned that erections are a vascular event, a sign of how well your blood vessels, nerves, and hormones are working together. Second, we busted the myth that erection issues are just in your head, reminding you that physical causes are common and worth addressing. Third, we explored the powerful practice of preloading your erection, priming blood flow, and calming your nervous system before intimacy. Fourth, we discovered the importance of your pelvic floor. Keeping those muscles balanced can make the difference between a soft and a strong erection. Fifth, we connected lifestyle factors like sleep, exercise, and stress management with erection quality, showing you that small, consistent habits really do matter. And finally, we learned when to seek help and what evidence-based treatments are available, giving you a roadmap for what to do next if self-care alone isn't enough. Your body isn't broken, it's just communicating with you. By listening to these signals early, you can prevent bigger health issues, improve your confidence, and create a more satisfying sex life for yourself and your partner. So here's one small but powerful thing you can try starting tonight. Spend 5 minutes before intimacy focusing on your body. Lightly stimulate or engage in gentle foreplay, do a few pelvic floor squeezes, and breathe deeply. See how much of a difference that single habit makes over time. And remember, this conversation is not just about performance, it's about connection, vitality, and self-respect. Your sexual health is a vital sign. Treat it like one. Stay curious, stay informed, and know that your body is worthy of care. If this video helped you, give it a like, subscribe for more grounded, judgment-free education, and share it with someone who might need reassurance that they're not alone. You deserve truth, not shame, and I'm here to give you both.